Hi everybody, Michele Kunz here. I have 10 hot tips on how to pass the basic cardiac life support tester exam. Also, they call it BLS, basic life support. So number one is to study and memorize my zombie notes. You might have some other materials that will be also very helpful to memorize. Keep rereading it and study very hard, and hopefully you have a guide for what's on the exam. So if you have my study guide, it really focuses on the questions that are on the exam. Number two is to read and study the basic life support material that you get from either American Heart Association or the American Red Cross, whoever, certifying you in this course. And they're going to have topics for adults, children, infants, the airway devices that you use, like the AMBU bag, sometimes called, different devices are called the pocket mask, the bag mask. There might be the AED, the automatic external defibrillator, and they have different size pads for different size patients. You have to know that. There's different, rates of compressions for the age groups, the way we compress on the chest. So there's different things you have to know for different age groups. So you have to study all those factors for your program. Number three is to dress comfortably, because many instructors will have mannequins on the floor, they'll have mannequins on the table, so you may be working up a sweat doing your compressions. If you have any limitations, let your instructor know. American Heart Association and American Red Cross, they have guidelines for those types of things, that you don't have to get on the floor if you're not physically able to do so. I have those videos on YouTube which go over AED, CPR process, so check out those videos on YouTube. Thank you very much. And my fifth hot topic is to study using practice exams. Your instructor might have forwarded you an internet exam, you might have a written pre-test exam, you may or may have to submit them to your instructor. So pre-tests are usually very, very helpful for passing the post-test. Number six has to do with the compressions and pressing hard and fast and coming all the way back up, which is called recoil. So you have to do a lot of physical activity, whether it's on the adult, child, and infant. Compressions are hard and fast, and you may have to do up to 5 cycles of 30 to 2. That's 2 minutes of CPR on each age group. So be prepared to work hard in your CPR class. Another thing is the differences between the age groups. And I mentioned that you'll have to be doing depth of compression differently, the rate of compression might be differently, the way we ventilate might be different for the different age groups. Also, whether we have an advanced airway, talking, like a LMA, laryngeal mask airway, or if the victim or patient is intubated in the hospital or outside the hospital, that could be possible also. The rate of ventilations is slower with advanced airway, so those are some of the things you'll be reading about. And if you're not taking a health professionals course, you might not be required to learn or even do the mouth-to-mouth ventilation component. Also, there's differences with pulse checking. So the focus really is on getting to the chest compressions, not wasting time checking pulses. So you'll learn things like if the victim is not responding, if they don't look like they're breathing, go right to chest compressions. So CPR is really focused on chest compressions and getting perfusion to the heart. If you're not taking a health professional program, you will also not learn to rescue or CPR. They want to simplify the program so you come out of the class knowing what you need to do. Again, all about the chest compressions. And if you have time, read about the different topics related to advanced airways, the AEDs, defibrillation, and then there's topics in advanced cardiac life support which lead out of the basic life support courses, which most will find very interesting. And participate in your class. The 10th tip is to participate in class, ask a lot of questions, and as you are reading or watch my videos, if there's any questions that you have regarding the CPR or other topics around this, please feel free to ask, okay? So I hope this is helpful to you in preparing for your basic life support class and other classes as well. Thank you. See you soon.